Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. I haven't made a video in a while. It's probably been about 4 months since the last time I made a video, but I'm back. And today's topic, we'll be discussing pre-kidney transplant workup. So let's go ahead and get started here. So pre-kidney transplant workup. I worked in pre-kidney transplant department for a few years and also post-kidney transplant. So I do have experience of both the pre-kidney transplant workup and also taking care of the patients post-transplant. But today we're just going to focus on pre-kidney transplant. So what is kidney transplant? A kidney transplant is a surgery to place a healthy kidney from a living donor or a deceased donor into a person whose kidney is no longer functioning properly. Most kidney transplants are placed in the lower belly on either the left or the right side of the abdomen. What is the role of the kidneys? Well, the kidneys remove waste products from the blood and convert them into urine. So a lot of times when we urinate, that is waste products coming out of our bodies. So if the kidneys, if they lose this ability, waste products can build up, which can be potentially life-threatening. And the kidneys also, they balance electrolytes such as potassium and sodium and other substances in the blood. Another role of the kidneys is to produce erythropoietin, which is a hormone that aids in the formation of red blood cells. The kidneys also regulate blood pressure, and they also regulate fluid and acid-base balance in the body. So why might a person need a kidney transplant? Well, a person needs a kidney transplant if they have ESRD, which is end-stage renal disease. That is when a person has permanent kidney failure. And most people with end-stage renal disease will need dialysis for survival, either hemodialysis or peritoneal dialysis. And dialysis is used to remove the waste and other substances from the blood. And we've already talked about that in one of my earlier videos. So who can get a kidney transplant? Patients of all ages, from children to seniors, can get a kidney transplant. But a lot of times it will vary from transplant center to transplant center. I know the oldest transplant person that we did in Dallas, he was 82 or 83 years old and he got a transplant and he did very well. But then there's some other places that maybe go up to 70, 75. So it just will depend on the kidney transplant center. But ultimately, a person must be healthy enough to have surgery, and they must be free from infection and any active cancers. So how is a person evaluated for a kidney transplant? So every person considered for transplant must get an extensive full medical and psychosocial evaluation to make sure that they are a good candidate for transplant. So usually the patient, they will talk with their nephrologist or maybe a social worker and let them know that they're interested. And then they will send a consult for the patient to meet with the transplant team to get started. And usually you'll either meet with a nurse or a nurse practitioner to get the workup started. And where I used to work, the patients would get consulted and they would meet with me first to get the evaluation started. And so some of the transplant workup we look for any current or recurrent infections. We check to see if they have any cancer that is active or that's spreading. We look for any severe heart problems, because if a patient has severe heart problems or an ejection fraction, at our clinic, it was 40% or below, they would not be eligible for transplant. But that would vary from transplant center to transplant center. We also look to see if a patients have any serious health conditions. If they have any non-compliance or failure to follow treatment plan. So if a patient is not taking their medications properly, if a patient's not coming to dialysis treatments or leaving treatments early, we look into all that and take all that into consideration. And also if the patient has no support system. So if a patient does not have anybody to help them, to be with them during the transplant and for the first few weeks after transplant to get them to their appointments, then a lot of times they will be denied for getting a transplant. So that's very important that a patient does have a support system. And also we do mental health evaluation. So they will either see a psychologist or psychiatrist to get evaluated to see if they have any mental issues that could be a barrier. We also, the patient will meet with social worker, and that will go over their finances and their things that are going on at home to see if that will be a barrier to transplant, and also a dental evaluation to check for any possible infections in their teeth. If some people have to get their teeth removed prior to getting the transplant, so they would need a dental evaluation as well. And we do tons of blood work, tons and tons of blood work for pre-kidney transplant evaluation. And we do a lot of infectious disease tests such as HIV, syphilis, gonorrhea, hepatitis B, TB tests to see if we're free from any infections. Also, we do a lot of diagnostic tests, x-rays, ultrasounds. We do ultrasound of the kidneys. Some people need a kidney biopsy. And then we also do screening such as mammograms and colonoscopy, depending on your age. And then we also check for PSA levels. And depending on age as well, or health history, we do a thorough cardiac evaluation. So we send you to cardiology where they'll do an echo or stress test. And then we also test for drugs and smoking. And at the VA, usually they want you to be smoke-free for 6 months from smoking any cigarettes. So what happens after evaluation? So after the patient completes the entire workup process, they get all the labs done, get all the tests done, then the patient is presented to the transplant committee. And then the committee will review all the tests to see if the patient is a good candidate for surgery. And if the patient is approved, they are placed on the transplant list. And the wait time for transplant starts, if the patient is already on dialysis, the wait time starts when the patient first started dialysis. So say if the patient got approved this year for transplant, but they started dialysis in 2017, they would already have 5 years of wait time. So they would get moved up on the wait list. And if the patient has never started dialysis, because sometimes we start the workup, usually if the patient's kidney function is 20% or below, but they're not on dialysis yet, we can go ahead and start doing the workup for a transplant. So if the patient has not started dialysis yet, they would just go on the bottom of the wait list for a deceased donor. And if the patient has a living donor, once the patient is approved for transplant, then we can start the workup on the living donor to see if the living donor is appropriate candidate to donate and see if they're a match and different things like that. And we can discuss living donation at another time. That is a lot of different things that factor in for living donation. So usually once they get started, the waiting period begins, and the average wait time for a deceased donor is usually on average about 5 years. So what are some of the risks of kidney transplant surgery? So of course, with any surgery, there are risks for complications: bleeding, infection risk, blockage of blood vessels to the new kidney. There's also leakage of urine or blockage of the urine in the ureter. Lack of function of the new kidney. So some patients, once they get a kidney transplant, they might have to do dialysis for a few days to give the new kidney a jump start. Also, one of the major risks and concerns is rejection. And so that is the biggest thing that most people are concerned about when getting a kidney transplant, is if their body will reject the new kidney. So rejection sometimes has no signs and symptoms, but most often it includes fevers, having decreased urine output, starting to have swelling, weight gain, or a lot of people experience pain over their transplanted kidney. Now, a lot of people have concerns about who pays for the kidney transplant. So Medicare covers about 80% of the costs associated with the evaluation, the transplant operation, the follow-up care, and the anti-rejection medications. And also private insurers and state programs may cover some costs as well. Post-transplant expensive may be covered for approximately 3 years post-transplant, where they cover everything and the medications. And the anti-rejection medications can be pretty expensive. So usually patients will speak with their social worker for more information about that and to see what type of coverage they can get once that 3 years is up. So what are the benefits of getting a kidney transplant? So most kidney transplant patients, they live longer because dialysis patients, the average patient lives on dialysis 5 to 7 years. So if you get a transplant, most patients live longer. Most patients enjoy a better quality of life because they're not tied to a machine. There's no longer need for dialysis. So you no longer have to go to dialysis anymore. Or if you're on PD, you no longer have to hook up every night for peritoneal dialysis. Most patients have higher energy levels because dialysis really wears the patients out. They really feel worn out, usually after dialysis. So with the transplant, you have more energy. You'll be able to work and travel easier because if you have to travel, then you have to make arrangements to go to a dialysis center wherever you're traveling at. So once you get a kidney transplant, it makes that a lot easier. And also you have fewer restrictions on what you can eat and drink. So a lot of dialysis patients, their diet is so restricted. You can only drink a certain amount of fluids each day. You have to limit potassium, phosphorus in your diet. So there's so many restrictions being on dialysis, but once you have a transplant, you're free to pretty much almost eat normally, because a lot of our transplant patients, their phosphorus is usually high where they're on dialysis. Then once they get a transplant, the phosphorus tanks. And so we're telling them, eat more phosphorus. And then they're so used to not drinking, then we tell them, okay, now you need to drink. Make sure you're staying hydrated. So it's a lot fewer restrictions on your diet. And also benefits of a kidney transplant: improve sex and increase fertility. So in summary, a successful kidney transplant is closest to the natural kidney function and is considered the most effective treatment for end-stage renal disease, offering a chance for a longer and healthier life. Kidney transplant, it does come with its pros and cons, and each patient will have to weigh the benefit versus the risk. And so on the next video, at a later time, I will discuss the post-kidney transplant, what to expect after you get the transplant. So thank you guys so much. I appreciate you guys taking your time and watching this video. Please make sure that you like, comment, and subscribe. And until next time, we'll see you later. You guys have a wonderful and blessed day. Thank you so much for listening. Goodbye.